Obesity is when our body mass index BMI is greater than 30. Obesity increased the risk of related conditions such as hypertension and type 2 diabetes, heart disease, arthritis and certain types of cancers. The overall energy imbalance, for example energy intake from food and drink then energy output through the physical activity and basal metabolic needs is the primary cause of weight accumulation. Excess intake of any form of energy, carbohydrates, fat, nucleic acids, is stored in the body as fat. Approximately 3,500 kilocalories is stored in each 1 pound, 0.45 kilograms, of body fat. However, some overweight people only eat moderate amount of food. And some people of average weight eat much more, but never seem to gain unwanted weight. Because many individual differences exist like hormonal problems, psychological factor, genetics and other health factors also involved in maintaining a healthful weight. There are many weight loss diet programs that are available in the internet, books and other sources. But we should understand there are no shortcuts for successful long-term weight control or weight loss. Weight loss requires hard work and strong individual motivation. The basic principles of dietary modification are: first, we have to set realistic goals. Goals must be realistic in terms of overall weight loss and rate of loss averaging half to 1 pounds per week. No more than 2 pounds per week. Second is negative energy balance. This is the most important factor that affects weight loss. A negative balance can be achieved through the combination of reduced energy intake and increased energy output. Third is nutritional adequacy. The diet must be nutritionally adequate to maintain a healthy life. Fourth is cultural appeal. The food plan must be similar enough to an individual's cultural eating patterns. Fifth is energy readjustment. When the desired weight level is reached, the kilocalorie level is adjusted in accordance with the maintenance needs. There are many common weight loss diets followed in the world. And here we are explaining about the diets and we will discuss about the benefits and disadvantages. Atkins diet. The philosophy of Atkins diet is eating too many carbohydrates cause obesity and other health problems. Carbohydrates prevent your body from burning fat, on the other hand ketosis leads to decreased hunger. So according to this philosophy, the Atkins diet advises us to eat meat, fish, poultry, eggs, cheese, high-fiber vegetables, butter, oil, nuts and seeds. We have to avoid carbohydrate, specifically bread, pasta, most fruits and high-carbohydrate vegetables, milk and alcohol. This diet advises us to eat 27% of proteins, 5% of carbohydrates and 68% of fat in our diet. This diet is practically difficult because of the limited food choices and difficult to eat in restaurants, but however if you can maintain this diet plan you can lose weight. Initially, the rate of weight loss is high because the initial weight loss is mostly water and then the rate of weight loss reduces. And also it is difficult to maintain for a long term because of the restricted food choices. Paleo diet. The philosophy of paleo diet is eating the diet we are genetically adapted to based on our hunter-gatherer ancestry. High protein, low carbohydrate intake will reduce risk of chronic disease and promote weight loss. According to this philosophy, the recommended foods are meat, seafood, fruits, vegetables, eggs, nuts, seeds and plant oils. Our diet should contain 46% of proteins, 28% of carbohydrates and 28% of fat. We should avoid grains, legumes, dairy, refined sugars, potatoes, processed food and salt. There are no theories or long-term validated researchers according to this diet plan, but there is a possibility for weight loss if the calorie intake is less than the energy output. At the same time, deficiency in calcium and vitamin D commonly occurs those who are adapted to this diet plan. The South Beach diet. The philosophy of South Beach diet is switching to the right carbohydrates may stop insulin resistance, reduce cravings and reduce weight loss. Recommended foods are seafood, chicken breast, lean meat, low-fat, cheese, nut oils, most vegetables, low-fat dairy, most whole grains and beans. We should avoid meats, full-fat cheese, refined grains, sweets, juice and potatoes in this diet. The composition of food should be 34% of protein, 14.8% of carbohydrates and 50% of fat. We can consume multivitamins and omega-3 fatty acids as supplements. There is research evidence that this diet promotes the avoidance of saturated fats, will risk of heart disease. Practically we can lose weight following this diet, and initial weight loss is mostly water and sustained weight loss through reduced calorie intake. Whole30. The philosophy of this diet plan is eliminating processed foods for a 30-day period, allows your metabolism to reset and rebalance this hormone levels. Recommended foods: meat, seafood, eggs, vegetables and some fruits. We have to avoid added sugar, alcohol, grains, legumes and dairy products. There are no evidences or researches published about this diet plan, but if calorie intake is less than output, possibly we can lose the weight using this diet plan. Zone 1 to 2 to 3 program. The philosophy is eating the right combination of food leads to a metabolic state at which the body function at peak performance and stabilizes hormonal communication, thereby leading to decreased hunger, increased weight loss, increased energy and increased control of cellular inflammation. We should consume 40% of proteins, 30% of carbohydrates, and 30% of fats strictly in our diet. We should avoid saturated fats. And also 200 IU of vitamin E can be taken as supplement. The difficulty in following this diet is, it is very difficult to calculate portions accurately that are required to be eaten, and there are also no long-term research evidences yet. But we can reduce weight by using this diet by calorie restriction and carefully followed and maintained diet. Although we have explained about the dietary plans above, the right quantity of foods you have to take in each diet plan varies with your body weight, height and your lifestyle. There are many ways to calculate our personalized daily energy expenditure, but they are only approximate estimations. But we can use one of them to calculate daily energy expenditure. Here we can use Mifflin-St. Cyr equation to calculate. For men, total energy expenditure, kilocalories day, you calculate via this equation. For women, total energy expenditure, kilocalories day, you calculate via this equation. Physical activity coefficients are: for sedentary people with little or no exercise is 200. For lightly active people with light exercise or sports 1 to 3 days per week is 375. For moderately active people with moderate exercise or sports 3 to 5 days per week is 550. For very active people with hard exercise or sports 6 to 7 days per week is 725. For extra active people with very hard exercise or sports or hard physical job is 900. So for each and every person we have to calculate their own daily energy expenditure and should maintain calorie intake less than that every day. For the rate of 450 grams weight per week, we have to maintain energy deficit of 500 kilocalories daily. Which means the total energy in the diet we consume daily should be 500 kilocalories, less than the calculated amount of daily energy expenditure using above method. The right amount of energy and variety of foods we eat is readily available on internet and books. So we can use that information and can easily calculate the right quantity of food we have to eat daily. According to your region and food culture, you can choose a diet plan which suits you most. Calculate daily energy expenditure. Calculate the quantity of food you have to eat. Practice and maintain the habit. And redesign the diet plan according to your new weight periodically. Good luck.